How do you change an industry? How do you change the status quo? Innovation. Out-of-the-box thinking.
Hello, this is Dr. Umar. For the past 10 years, my team and I at the Dr.U Hair and Skin Clinic have worked tirelessly to bring forth a simple hair transplant system that will deliver results consistently for all patient demographics, regardless of ethnicity, skin or hair type. Additionally, Dr.UGraft was created to address the problem of donor supply limitation. It does so through its ability to successfully excise body and beard hair when donor supply from the head alone will be insufficient for a successful, credible-looking restoration. After several publications in major peer-reviewed medical journals and years of delivering consistent patient results, we have refined our creation fully, both in concept and engineering. It is the first intuitive hair transplant system that adjusts to each patient's specific skin characteristics, featuring several patented and patent-pending innovations in engineering. The system delivers successful, minimally invasive follicular unit excision, even when other hair transplant systems have failed. All donor supplies for all donor areas can be utilized: head, nape, beard, trunk, legs, arms, without exception. Furthermore, the intelligent design of the system renders the FUE process easy to master, with a drastically reduced learning curve. I introduce to you the Dr.UGraft hair transplant system.
As we can see, the operator doesn't need to worry about depth control. He just pushes the punch deep. So again, engulf the graft, touch the skin for a microsecond, and then go deep. We can see how the punch stops as it goes deep. It is attempting to begin spinning again, but there is a lot of resistance. This is because of the design of the punch. It is meant to increase resistance as it goes deep, so depth control is not an issue. operator is grading the force and actually going in with force. This is how to use the Dr.UGraft Intelligent Punch to make life much easier. Now, the operator pulls out the grafts. The next thing that needs to be done is dipping the growths. And now, the swipe maneuver is performed, and then wipe. We can see all the grafts are there. In this case, there is no need to manually pick them up. In this video, we will demonstrate the fluid system of the Dr.UGraft hair transplant system. This is a very unique feature of the Dr.UGraft compared to other hair transplant systems. It is the only system that has this integrated into its function. The fluid hydrates the grafts, lubricates the tip of the punch to minimize friction and enhance punch glide, while enabling hands-free graft rescue. All these factors combined together, derived from the fluid hydration feature, contributes to making the Dr.UGraft an intuitive FUE device. Here's what the dashboard looks like. This button is used to switch on the irrigation of the fluid system. This other button is used to control the rate at which the fluid drips to the tip of the punch. In this case, it is set at the maximum, which is 5 bars. You use the left pedal to rotate the punch, and the right pedal to eject the fluid. Now, let's see how it works so we can demonstrate its advantages. It deposits the fluid as you go along. It hydrates grafts. It lubricates the tip of the punch, so the punch can glide better around the grafts and reducing friction around the grafts. This reduces transection, and when it gets stuck like this, it is ejected by a pulse of fluid. We can see how the grafts are rescued intact. The operator doesn't have to interrupt the procedure in order to remove them with forceps or sacrifice them. You only have to press a foot pedal and the graft is rescued intact. Dr.UGraft fluid system in action. Graft hydration and punch lubrication in action, and rescue of impacted graft like in this case. There is no need to stop the procedure. There is no damage to the grafts. As the operator proceeds, he can use the fluid feature to hydrate all the previously extracted grafts so they don't get dry. This can also be done to clean up the blood on the area. It hydrates and clears the area of any blood. This is the Dr.UGraft fluid system. It is the only FUE system that works this way. Here the grafts are growing inside the scar. The scar has not only distorted the angle of the hair that is deep in the skin, but it is also holding on tightly to the hair follicles. With Dr.UGraft Intelligent Punch, the operator can take on these cases very easily, without worrying about the angulation of the hair and with minimum skills required. Let's observe how the operator is handling this case. What they want is to let the punch in the device drive itself and score the grafts without any input from the operator. Notice how the operator is just letting the punch drive itself and stop itself. Now we have misangulation, deliberate malalignment, and also letting the handpiece and punch drive itself in a very difficult case of a scar area in FUE. Now they are pulled. Self-driven FUE. These are the grafts in the scar area. We can see the scars. There is no input from the operator. Just let the Dr.UGraft an intelligent punch do the job all by itself. The operator just had to hold the handpiece. Absolutely no guidance from the operator. The punch goes in and it navigates the graft all by itself. Frees it from the scars holding it. It stops on its own when it gets the proper depth, all by itself with minimum input from the operator. We can see the grafts are robust. Even in the midst of scar, they are quite good. It's easy to learn and easy to practice. That's what you can expect in FUE using intelligent punch coupled to the Dr.UGraft nurture handpiece. In traditional FUE, the operator would typically need to angle the punch to exactly align it to the hair axis. It would involve the operator maneuvering considerably to get it right, as the hair angle changes from one point to another. Here, it's more convenient for the operator to hold it that way, and they do it with no concern for hair angulation. It is convenient for the operator to hold it in a near vertical plane, as opposed to this way, which is in line with the actual hair angle. Here it is virtually perpendicular to the hair axis. Again, angular nape hair. Twelve of 12, and no transections. Why is this possible? Because of the design of the punch. No suction. What other devices require suction to achieve, this Dr.U punch achieves all by itself. And then the rest is done by this handpiece. That is why it's called the intelligent punch. And the rest of the attributes are from the Dr.UGraft nurture handpiece, which complements the intelligent punch perfectly to make all this possible. The Dr.UGraft handpiece operator is going in with the intelligent punch with less concern for chest hair angulation, hair to punch alignment, or depth control. Without extraordinary skills, all he does is engulf the hair, place the punch at the hair's skin exit point, and push without attempting to control depth of penetration. With swipe maneuver, many of the grafts come out, and in this case, are mostly lying free on the skin for easy pickup. The operator takes out the ones that are hanging loose with forceps. Thigh and leg grafts are literally flat on the skin, and the operator is not necessarily holding the handpiece flat against the skin, he is just letting the punch do the job by itself. The hydration system on the punch is lubricating the extraction point as the punch goes in. The punch stops by itself at the right depth. In this case, the operator is deliberately going slow, so we can see how easy it is to do the job. With the Dr.UGraft Nurture handpiece, just touch the point of the hair exit and then push. As simple as that. Go in, touch the point, and then push. It doesn't matter what the angulation is, just touch exit point and push. Engulf the hair, touch exit point, and push. No extraordinary skills are necessary. This is an intuitive FUE system that is literally doing the job for the operator. As you can see, the hairs are coming out intact. You can expect the same great results with any type of hair on any part of the body. Unmatched consistently. Curly hair, long hair, angled hair, it doesn't matter. Now it's time to pull the grafts out. The operator pulls the grafts out. We can see what the thigh hairs look like. As witnessed earlier, the operator did this without exerting extraordinary skill, with no concern for depth, angle of hair, or punch alignment. The intelligent punch complemented by the Dr.UGraft Nurture handpiece made it easy for the operator. Thigh hair extraction, Dr.UGraft body hair transplant extraction of thigh hair. Thigh grafts typically look similar to leg grafts. Extracted by Dr.UGraft, the grafts are viable, robust with plenty tissue surrounding them. These are extracted with minimal stress or injury and would grow when implanted. The punch is self-navigating. There is no need to manually guide it. The hydration system lubricates the punch tip and graft. There's no need to try to guess and manually navigate the angle. Let Dr.UGraft and the intelligent punch guide itself. This device has no suction feature. There is no suction device attached to it, either that is trying to suck the life out of the graft. The pulling effect is entirely the result of the punch's intelligent design. It pulls the graft. It guides itself through the course of the curvature of the hair. Coupled to the Dr.UGraft Nurture handpiece, it stops itself at the correct depth. It is doing this all by itself without transecting the follicle. The graft comes out intact because of the pulling effect of the intelligent design of the Dr.UGraft punch. Another very important advantage of the pulling effect is that there are no buried grafts. All this together aids in getting a better graft survival and regrowth for a happier patient and doctor. For the doctor, it is helpful to minimize the mental and physical exertion needed in guessing and when trying to skillfully navigate hair curl and bend angles for each extracted graft. In a procedure of thousands of grafts, that would have been very exhausting. By minimizing this, Dr.UGraft Revolution, working together with its intelligent punch, is advantageous. At the end, we have a number of grafts that came out. As we can see, they are all intact with their connective tissue sheet around them. They are not excessively splayed. Excessive splaying is a sign of lower quality graft. For the first time, there is one unit that confidently performs every kind of case, with minimum transections, with very good wound profile, very high quality grafts, and minimum effort or skills needed from part of the practitioner. There is less need to struggle guessing angles or positioning and placing the punch in particular ways that requires extraordinary skill sets. All one needs to do is aim, touch the skin and move, aim, touch the skin, aim, touch the skin, stab, touch the skin, touch the skin, touch the skin, touch the skin, and with FUE swipe maneuver, 50% of the job is done right there. For the first time, people of African heritage can now enjoy the boon of what we called FUE. Previous to Dr.UGraft Revolution, this patient population was forced to take their chances with inefficient FUE procedures that mostly resulted in high graft damage rate, or forced to resort to strip-type surgery, which results in a linear scar on the back of the head. This is ironic because this is the demographic of all racial groups in the world that prefers to shave their heads. And until Dr.UGraft came to be, we didn't have a consistent, efficient FUE system for them. They were forced to resort to the strip surgery, ending up with lines of scars on the back of their heads which precluded them from shaving their heads. Well, that's no longer the case. There is a system now that works for all African hair FUE. This system is the Dr.UGraft Revolution. It is a system that does all types of hair: African, Caucasian, Asian, straight hair, curly hair, curled hair, cycled hair, with no exceptions. Whether the hair is on the head, the beard, chest, abdomen, legs, arms, it doesn't matter.